Hello, this is Group 9A. Ajay Saini, Yogesh Kumawat, Dushyant Kaswan, Mohit Doon, Ravi Kumar, Hitesh Meena, Anirudh Singh, Naveen Kumar, Rinku, and Sachin Saini. Presenting our self-work to Abdul Qasimova Dinara ma'am.
Today we are students of 9A group 3rd year of O State Medical University. Today we are presenting our topic on cutaneous tuberculosis. Tuberculosis is a disease which is caused by germs that spread from one person to another through the air. TB usually affect our lung, but it can also affect other body parts such as our brains, kidneys and spine. A person with a TB can die when it is not treated. Now let me tell you about cutaneous tuberculosis. Cutaneous tuberculosis is a result of chronic infection by Mycobacterium tuberculosis M. ovis, and it is occasionally by the Calmette guerin bacillus. The clinical manifestations are variable and depend on the interaction of several factors, including the site of infection and the host immunity.
The skin tuberculosis. Skin tuberculosis is the prolonged infection caused by 3 types of bacteria. First one is the Mycobacterium ovis, second one is the Mycobacterium tuberculosis, and third one is the Calmette guerin bacillus. Risk factor for the cutaneous tuberculosis, there are 3 types of risk factor: environmental, mycobacterium and host. In the environmental, poverty, crowding, social disorder, nutrition and HIV in the infections. But in the mycobacterium, there is virulence, dosage and other mycobacterium exposure. And in the host, genetic.
Different type of cutaneous tuberculosis is the TB verrucosa cutis, tuberculid, lupus vulgaris, scleroderma, miliary tuberculosis.
Pathogenesis. Pathogenesis of a cutaneous tuberculosis is that when the once bacteria enter into the skin due to the primary infections or other kind of infections, and it is taken by the immune cells called macrophages. Macrophages are the basically immune cells. In there bacteria will survive and replicate and form a granulomas. Granulomas are a small cluster of immune cells that forms in the response of the process of inflammations, and they also carries the bacteria and other inflammatory cells also, and they will then move from their original site to the other sites, and like to the bones or the lymph nodes and the skins, and they cause their infections also. And in the skin there will be granulomas, will form ulcerations in the skin, and which also give the secondary infection to the complications also.
TB transmission and pathogenesis. Tuberculosis is an infection which spreads through the droplets from the cough of an infected person, which remain in the air for several hours. When the droplets are inhaled by another person, they travel down the person's trachea to reach the lungs, where they get deposited in the alveolar sacs. Here, the TB bacteria multiply, activating the body's immune response, resulting in macrophages surrounding the bacteria to form granulomas, thereby containing the spread of the TB infection in the lungs. The patient tests positive for latent TB infection within 8 to 10 weeks. Latent TB infection can progress to full-blown TB disease when the bacteria break out of the granulomas and multiply in the lungs, making the patient sick from TB disease with the likelihood of infecting other individuals. This could happen immediately after the infection, many years later, or not at all. When the TB bacteria escape from a granuloma and infect the person's lungs, the condition is known as pulmonary TB. A cut section of such granulomas often show a cheese-like appearance, known as caseating necrosis. The primary site of TB infection in the lungs is known as Argonne focus and is usually seen in the upper part of the lower lobe. or the lower part of the upper lobe. When the TB bacteria enter the bloodstream and spread to other parts of the body, especially the lymph nodes, kidneys, brain, or bones, the condition is known as extrapulmonary TB. Prevention of TB in countries where the disease is common is through the administration of a BCG vaccine in infants, which prevents the development of severe TB in children. The vaccine, however, is not very effective in the prevention of TB in adults. Dozens of new TB vaccines are presently in the various stages of development and testing, with the objective of developing a more effective vaccine for the most affected regions of the world.
Symptoms and conditions of skin TB includes tuberculous gangrene, that are also known as primary inclusion TB, and then second one is erythema induratum benzine, that will be formation of painful purple lesions on the legs, and then there will be papillonecrotic tuberculosis, there will be large lesions on the feet, legs, hands and arms. Then they will be often accompanied by the fever, fatigue and loss of energy. And next one is tuberculosis aurificalis, that there will be large lesions and irregular ulcers in mouth, throat and genitals. And granulomatous mastitis, that will be seen in the breastfeeding mothers, and it's characterized by the tender and the painful breast lesions that are often scary.
Laboratory test, chest X-ray, CT scan, sputum, blood and urine culture, skin biopsy, bone scan, Mentox test, PCR.
Tuberculosis. Medication prophylactics. BCG vaccines in some countries. Latent tuberculosis isoniazid for 9 months. Inactive tuberculosis first line anti-tuberculosis drugs. Isoniazid, rifampicin, paranazamide, ethambutol, streptomycin. Antibiotic resistance for multiple drug resistance tuberculosis. Treatment requires second line drugs. Amikacin, kanamycin or capreomycin.
Prevention. Get vaccination. Vaccination is a widely used vaccine for the prevention of tuberculosis, and maintain good hygiene and avoid contact with infected individuals. Follow infection control measures and improve your immune system. Second is complications. Complications is the spread of the infections and scarring and ulcerations, and second in bacterial infections, and improve immunocompromised individuals and secondary bacterial infections.